We have joining us Dr. Jamal Gwathney. He is a medical doctor, clinical director, Metropolitan Correctional Center, and the San Diego Federal Bureau of Prisons, and the National Public Health Department as well. Has been a board certified family medicine physician for over 20 years and is currently an active duty captain in the United States Public Health Service. During his career, he has served underserved communities across the country and really across the world. He has been a medical director of a community health center in Washington, D.C., deployed to help lead a unit to fight Ebola in Liberia, and supported the community of Flint, Michigan during the lead water crisis. And he's been stationed as the medical director of the Federal Bureau of Prisons facility in San Diego for the past 8 years, and that is Dr. Jamal Gwathney. I want to go now to Dr. Jamal Gwathney. He's going to talk about clinical trials and the real life experiences with the COVID vaccine, as well as the public health implications of not getting that vaccine. Dr. Gwathney?
All right. Well, thank you for having me, and thank you. And it's great to be here with the other panelists. I think I was asked to talk about the clinical trials because I've done a lot of research on the trials, specifically the Moderna and the Pfizer vaccines. I've done a lot of presentations. We've given many vaccines at my facility, but probably most importantly, I'm actually a study participant right now. I am currently in specifically the Moderna trial and have been since August of this year. I joined for the main reason of wanting African-American representation and volunteerism in these studies. Typically in NIH-funded studies, usually only about 5% of the participants are actually African-American, when 13.4% of the US population is Black. So we need to have more representation in clinical trials. So if, I did my research, I looked at the earlier research studies, meaning the phase 1, phase 2. I found that they were safe, and then volunteered for the study myself. I'll go into my personal experience. But if you're interested in clinical trials, please talk to someone, as Dr. Hood mentioned, doctors, nurses, someone who knows about clinical trials. Could be a scientist that you know. See if it's something that you'd be interested in, because we need more representation in these studies to make sure that when new medications come out, new vaccines come out, that they're not giving them or offering to us for the first time after the studies have been done. We want to be included in the studies to make sure that they are safe and effective for us before they get approved. Next slide, please. Next slide. So this here was, as Dr. Hood discussed, African Americans have been wronged by the scientific community for years, but it's not just years ago. Like I said before, like was mentioned before, I was in Flint, Michigan, where the state government blatantly lied to the people of Flint, Michigan. And I was on the ground there talking to the residents of Flint, making sure their messages were heard and their desires and wants and needs were heard and brought to the county, state, and federal levels. I think things are happening in medicine right now that are issues where females who are pregnant should not, and African American should not die 3 times as much as their white counterparts. So I think this article here that I brought up is in the New England Journal of Medicine back in October of 2020. And it really struck a chord with me: trustworthiness before trust. And the article basically just discusses how it would be insane to just bring a new medicine, bring a new vaccine, and ask the African American community to just trust us and trust that it's going to work. That would be insane. What needs to happen is that the scientific community needs to earn our trust and basically be worthy of our trust, hence the title, Trustworthiness. And so I'd like to talk a little bit more about how I think the research community has actually started showing us that they are trustworthy. Next slide. So before we get into actually this slide, I want to talk about, was this to fast? Was the process too fast? Operation Warp Speed. And was it fast? Yes, it was. Did it need to be fast? Yes, it did. You know, we have over 400,000 COVID-19 deaths right now. The only other time that we've had this many deaths from a contagious disease was, as Dr. Wooten mentioned, the 1918 H1N1 flu. And so we needed something to be fast. And luckily, our technology has improved over 100 years, and we were able to get something out faster. Uh, I want people to know that these pharmaceutical companies did not take a big risk. Our federal government actually took the risk and paid the pharmaceutical companies billions of dollars, literally, to actually start producing the vaccine before they even knew if it was going to get approved, if it was safe, if it was effective, because they wanted to have it ready to be distributed if it was approved. So the federal government took a big risk in giving pharmaceutical companies a lot of money. And this mRNA, these Pfizer and Moderna vaccines, the messenger RNA, as they're called, is not new. And we've had this for 30 years. We've used it for different things. It's the first time we've used it for vaccines, but it's not something that just came on the scene this year and we just created it this year. We've been using this for many, many years. So back to the slide, I want people to kind of get an idea of the normal vaccine process usually has 3,000 to 5,000 participants. So when we have 30,000 in Moderna and 43,000 in Pfizer, 73,000 participants, which was actually mandated by the government. They had to have at least 30,000 participants. That's a ton of data. We have much more data than we would normally have in a vaccine study. They also mandated that they had to go through at least 8 weeks of data before submitting to the FDA for authorization, because we all know from the prior vaccine studies, that most 95% of the adverse reactions will happen within the first 6 weeks after getting the vaccine. So they mandated that they have 8 weeks of data, so they know they would catch 90 to 95% of any adverse reactions. Again, in 73,000 participants. I want people to know that both studies included a significant amount of African Americans. Like I mentioned before, usually only 5% of studies have, or 5% of the are African American in these studies. Moderna had 9.7% African Americans, and Pfizer had 10%. So almost double, pretty much double the normal baseline. And they also included people with diabetes, hypertension, lung conditions, people on medications, people older, say 80, 85, and younger down to 16 or 7 or 18, particular depending on the particular study. So again, we have a lot of information to know that they're safe and that they're effective. It was not too fast. We did it quicker so that because we had so many deaths going on. Next slide. So I want people to know what will happen. So I've been giving these shots to staff and patients over the last month or so. But from the studies, the 4 most common expected effects. You can expect these things to happen. You're gonna potentially have headaches, body aches, joint pains, or fatigue, feeling really tired. Those are 4 things that you should expect. If they happen, that means my immune system is working, the vaccine is working, you know, I'm expecting this. These usually only last 1 to 2 days, you know, maybe a little worse. The studies have shown after the second injection. So the first one, you might not have, you know, as much of a reaction, but usually after the second injection, it happens a little worse. Now, when we say these are the most common, they only happen in about 10%. Those are the most common ones. So 90% of people won't have any real effects, but if you're going to have, if you're in that 10%, you'll have these particular side effects. And interestingly enough, as we get older, our immune system gets a little weaker, but luckily that means that we get less side effects. So both studies saw that as you get older, over 65 actually had less side effects than people 55 and younger. So potential benefit of our maturity. my experience I put in here. So I, again, joined up because I wanted to have representation of African Americans in these research studies. I called up in early August. They took my name, number, asked me a lot of questions. I actually went in late August. Again, more questions, drew my blood, swabbed my nose for coronavirus, and then gave me a shot. That was late August. I had a little arm soreness. It didn't get swollen, didn't get red, but it was sore, like I, got a shot. And we had to fill out forms, fill out an app, all our symptoms that we were having, had to take our temperature for 7 days. And then once a week, we'd get a phone call that anything changed. 28 days later, went and got my second shot and did again, nose swab, blood work, answering questions. After my second shot, I didn't actually have any side effects at all. Um, and then answering more of the questions and the apps. And this was all with Moderna again. I will say that of all the shots that we've given at my office, and we've been given Pfizer, a lot of people have been having the side effects that are the expected effects that are listed here. Sometimes they had so much arm pain that they needed to take some Tylenol or Motrin, which is okay. Don't take it beforehand, but it's okay to take it afterwards. But these effects, that was my experience, and many of the folks did have more reactions after their second shot at my office than with the first shot. Next slide. And this is my last slide. I'll finish up here. If you're not getting vaccinated, it's a risk to yourself, obviously, and we know there are short-term and long-term effects from getting coronavirus. We definitely know, I just told you about the short-term risks from the vaccine. And again, those only last 1 to 2 days. Not too many, we don't know of any long-term effects just yet. And we're gonna keep watching those. It's a risk to your family. So, anytime we get something, and then the most common contact is our family. And we don't wanna bring things home to our family. More mutant strains, if you're not getting vaccinated, it puts pressure on the virus to change to be able to infect people more easily. And then obviously, if we're not getting vaccinated, this whole pandemic situation will last even longer, and we could be in this situation for years to come if we're not getting vaccinated. So I'll stop there, and hopefully we can have a lot of questions and give a lot of answers. Thank you.